Speaking of friends, real ones, Israel Friends reached a milestone, representing both hope but also the urgency. This unique organization now treated 10,000 patients across the country to solidify and strengthen mental health. But this number is also telling a much greater story about this entire nation, still a nation in crisis, and the potential ways, solutions that are being built as we speak to help it rise to the challenge. We're delighted to welcome here in studio Mr. Carl Blank, Executive Director of Israel Friends. Thank you so very much for coming into our studios tonight to talk about this important topic, Mr. Blank. So what does reaching this milestone, as you've put it, 10,000 patients, actually mean?
Thank you for having me and for providing the chance to speak about this critical topic of mental health in Israel. Israel Friends is a North American Israeli nonprofit and started on 10/7 working on innovative ways to save lives in Israel, specifically in the mental health and defense environments. And what we've seen is early in the war, over 2 years ago, in November 2023, it became impossible to meet with a psychiatrist. And just there aren't enough doctors in this country, regardless the amount of individuals, families traumatized from what happened. And so our experience showed that what was a 3-month wait as a new patient skyrocketed to 6, 9, 11 months. Today, 7-month wait period. And we said, it just doesn't work. You can't wait 6, 7 months to see a doctor if you need it. And so we rolled out what is now the #1 telehealth platform in the country, where instead of taking over 6 months to see a doctor, it takes just 3 days. In 3 days, you can meet with a doctor. And as you said, just last week, over the course of the war, we have seen over 10,000 patients nationwide, and the program is working, it's successful. And what to me it means is that we have the capacity as a civilian front, as a nonprofit, to say, we can transform the mental health care system in Israel.
So it's like a mental ER, so to speak, to give initial treatment or initial response, not instead of the country's mechanisms, but to complement them.
Exactly. We complement. We work with phenomenal partners, the Ministry of Health, as well as many other players, Maccabi, Khalit, the resilience centers. We're a partner with them to make the system healthier and stronger, providing immediate access to psychiatric care.
So illustrate as much as you can the current state of affairs. What is Israel really dealing with? What the Israelis are dealing with?
It's a hard reality. We've said a lot of numbers, sitting in this chair, many people have thrown out numbers over the last 2.5 years. The data was unclear. And the reality is in Q4 of last year, just a few months ago, we realized we need to see what's the newest assessment. Where do Israelis stand? The truth is that over 15% of Israelis have mental health duress on a daily basis. What does that look like? 500,000 Israelis experiencing PTSD, and over 1 million Israelis experiencing medium to high levels of anxiety, depression, suicidal ideation, and other mental health duress.
And we're not talking just about soldiers who've been out in the battlefield. We're talking about, quote unquote, ordinary Israelis.
Every Israeli, we're talking about 1 in 7 Israelis have mental health duress on a daily basis. Now, I would say all 10 million of us have some low levels of something because of what's occurred. But we're saying 1.5 million people have a plague that impacts them every single day.
So what do you do?
So what do? We provide this platform and we work with incredible partners to disseminate this care. Our first partners were the resilience centers in the South and the North. That was followed by the Ministry of Health, helping us expand our work. And today we actually partner both with Maccabi Health as well as Khalit Health to provide national care.
So from this point onwards, for our viewers who want to join the effort, or just, us Israelis who want to be there for one another, what can be done?
Of course. So I appreciate the question. Our work is with global partners who love our nation, love our people. And you can come and look at us, israelfriends.org. You can come and look at our work. We do work, innovative efforts in defense and healthcare and mental health. And what we do is we're constantly looking for ways to help those who need it most. And so with us in our Healthy Mind program, with our American, Canadian supporters around the world, $600 a person is giving them end-to-end care. That's helping that individual, their family, their friends, their children, and everything in their lives. And so we're constantly growing and expanding, and that's at israelfriends.org.
Yeah, and you know, on the one hand, the higher the number is, the greater the distress is, but also it indicates that more people are reaching out to get help, which is obviously a good thing.
Yes.
They don't have to go through this alone. Kyle Blank, thank you so very much for coming into our studios and again highlighting this crucial topic for our present and more so our future. Thank you very much.
Thank you.